What if I told you health insurance isn't just broken, it's bankrupting you, and there's a smarter way out? Well, in this episode, I'm joined by Andy Schoonover, founder of Crowd Health, to reveal how a cash-based community-powered model is flipping healthcare on its head, and why I made the switch myself from corporate insurance to health share program, back to corporate insurance, and now to where I should be with Crowd Health. So I've already got some skin in the game and some stories that I talk about in this podcast. And Andy goes on to explain a lot more, from massive savings to real stories from his other members. Don't miss this game-changing conversation. You might want to switch. Real quick, my SKOOL community is ever growing. Check out the link in the show notes. It's where I'm spending all my time with my audience. It's basically a community much like Facebook groups, but a lot more interactive. We have coffee chats. I'll be doing Q&As pretty soon, as well as having other like-minded over 40 people who are interested in, rapid weight loss, longevity, new tech trends coming out. So it's not just me in there. And get in while you can before I hit my first 100 people, because after that, I will be charging to new people only. So let's get on with the episode. Andy, just wanted to thank you for coming on my show. I recently was at my annual doctor visit, and my doctor, Dr. Brian Lenskys, also has a podcast called Low Carb MD Podcast. And I was telling him all the different problems I was having with the corporate health insurance. He's like, you got to check out my podcast episode I did with Andy and Crowd Health. This might be right up your alley. So I listened to that episode, and I'll put a link in the show notes because I'm going to ask totally different questions than all the info I got from that podcast. So I want to push my audience to check that out as well. But before we get started, Andy, how did you get into forming this company? What's your mindset like? And then we'll start getting into the good stuff.
Yeah, well, we love Dr. Linsky. I'm over 40, so this is right up my alley. Thank you so much for having me. This is my second healthcare company. I sold my first one, and as a result, I didn't have insurance from my employer, so I started looking for options. I thought my only option was to go to one of these Affordable Care Act marketplace plans. It was $1,100 or $1,200 for me, my wife, and my two girls, and I joke it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections and went to the pediatrician, who said she has a hole in her ear, so we had to go get that fixed. Went to the ear, nose, and throat doctor. He performed a 15-minute procedure, and I got the bill in the mail, and it was $8,000 for a 15-minute procedure. I'm just like, wow, like $8,000 for 15 minutes is just absolutely crazy to me. But this is what health insurance is for. Like, this is the whole point of health insurance, right? Unfortunately, I got another mail from my insurance company that says medically unnecessary, and so they weren't going to pay for it. And so I appealed that twice, and at the end of the day, they didn't pay for it. So I had to stroke an $8,000 check for this procedure that she had. I called my health insurance plan. I quit. If you're not going to pay my bills, I'm not going to pay your bills. And so we became, in essence, uninsured. My wife looked at me and was like, okay, so now what are we going to do? And so as I went on a 18-month mission to figure out, is there a way that we can actually pay for these big bills without being a part of the medical industrial complex, insurance-led system? As I built these set of tools, I figured other people would be interested in these tools too. So I started Crowd Health. Now 4 years into it, our 4-year anniversary is next week. We've helped almost 15,000 people over those 4 years fund 20,000 bills really effectively. That's a bit of the background of the company, but ultimately we're trying to give people a true alternative to health insurance to pay for these big bills.
4 years ago, I had the same thing. I couldn't stand the corporate healthcare and sick care versus actually getting healthcare. And also because I was getting priced out. If you're unemployed or self-employed, you're really getting burned on the rates versus the big corporations. They get the better rates and they can offer their employees benefits, which is great. But for me and my wife, this is not fair. So we actually switched to a health share, one of those religious health share programs. It still met the minimum insurance for California. I actually had an okay experience with them, and they paid for a lot of stuff. It took a while. And then as we kept going after like 2 years, it seemed like, and I was going down the Reddit rabbit hole. I always say that, where real people are talking, and they were just saying these health share programs are just mismanaging their money because all they care about is being tax exempt for themselves. They really don't care what the business is doing. And we saw every year or 6 months, the rates going up. We're like, oh God, this is not cheap anymore. Now it ended up being the same prices, the bigger ones like Blue Shield and Kaiser. So on my last month, I was like, all right, we're switching. So in December, I can't remember what year, a couple years ago, switched from it back to Blue Shield, made sure in emails that I am covered up till December 31st at midnight in 1 second, because I'm switching. They're like, yeah, you're good. And I signed up for Blue Shield. That New Year's Eve party, we had a lot of little children around with my daughter, who at the time was 6, and they were playing in the bonus room. And she ended up coming back out around 11:30 at night with a little gash on her side, opened up, just blood everywhere. Tiny little half-inch cut. For a kid, it's just a bleeder, right? We rushed her to the urgent care, and basically it was just a simple glue stitch that cost, I think, $4,500. But I was like, cool,
oh my goodness.
I have coverage all the way up. Come to find out, this share company basically said that's not how it works. If you read the bylaws, that last month you have to pay your membership because that's part of the deal, but you don't actually get any of the share benefits for the last month. I was
Oh,
like,
geez.
what? How could you not tell me that? Like, look at my emails. I basically told you my plan, and you're like, well, so that was it. So I was like, okay, done with that. I hate the corporate health care plans, but we've been eating it, just paying $1,400 a month for a family of three
Yeah.
with a $5,000 deductible. Then I saw all your stuff and signed up immediately after I did my due diligence, and it's just, I've been having a great experience.
We love that.
So for my audience, there's the corporate health companies, obviously regular insurance. Then there's the ministry tax exempt health insurance, health share programs. I explain my experience, and there's a million of them out there, but they're getting a little bit more pricey. Now there's crowdfunding. Can you, in a simplistic way, how is that not insurance? How do you get around that?
Sure. I've had experience with all three. Being the CEO of Crowd Health, I've clearly had experience with that. I told you my corporate health insurance. I actually had a health share for a while too. One thing I realized is the big difference between the health shares and Crowd Health is we take a very active approach in negotiating with these doctors and these facilities. And so instead of just going to whatever orthopedic surgeon, the one step we ask you to do, which you don't have to do with health insurance and health shares, is call us so that we can find you a really good doctor at a low price or negotiate with the doctor that you really like. And we find that those negotiations, we can get these prices down by 40 or 50%. I think that's the key here, that we take a fairly active approach in helping our members find really good doctors at a really good price. In fact, we put together this marketplace of cash pay prices for our members to have access to. If you need labs in San Diego, we can tell you where to go. If you need a knee replacement in Austin, Texas, we've got a great place with a really good doctor that'll give you a really good price. And so that's really what sets us apart from some health shares and definitely from health insurance, is we've got this huge database of doctors that can give you a great price. As a result of doing that, you're paying much less because we're able to get these bills down significantly for you. So that's a big difference between us and health shares and health insurance. One other thing that's important is that you can actually get these prices down by 50 or 60 or 70%. In fact, our members are getting 50% better prices than United Health for the services they are providing. So this is the 7th largest company on the planet. And our members, who are all acting as individuals, can actually get better prices than that. And so the question is why? Well, the doctors, these facilities, they spend somewhere between 30 and 40% of their revenue to actually get paid. These doctors spent about 2 of their 5 days a week fighting with health insurance plans to get paid. And so there's so much in this process that if you can rip all that bureaucracy and that administrative expense out, you're going to be able to get way better prices. So that's what our system is built upon. We have 10,000 people currently active in our membership. And what they're doing is they're funding each other's healthcare bills so that when they do have to go get these procedures, they have the money in the bank to actually pay for them directly, and therefore getting significant better prices. So that's what our system is built on. Like I said, we've done this for 20,000 bills over the last 4 years, and 99.8% of those bills have gotten fully funded. So that's significantly better than the health shares and significantly better than the health insurance companies. And so it's a super fun ride to see this actually work.
It's been very interesting experiencing this myself too. And I want to throw out there to the audience, once again, there's regular health insurance. Everyone knows what that is. Then there's the religious health share type programs where you can't call that insurance either, yet it almost works exactly the same way. I don't like the way they've been managed. And then a company like yours, which is for profit, so you have to actually care and try. I see your reviews everywhere on Trustpilot and everywhere. They're all 5 stars. That's awesome. That's what you want to see from a company. Not to mention, I can talk to the founder right now. Everyone needs to know this. Crowd Health is basically, you are now a cash paying person. There is no insurance, but the way this works through crowdfunding with that high percentage payout that you just mentioned, if you're doing it the right way, and we'll go into that in a second with my experiences, I've already experienced getting prescriptions at CVS just for hair, not Propecia. It's like $50 for 3 months, not even a big deal. And then I just went and they're like, oh, you don't have insurance anymore. And I was like, oh no, I just switched to this cash pay system. So I guess I have to go through the app and do all that. They're like, no, you can actually talk to the person on the backside of the thing there, and they'll just run it through GoodRx and all the coupons and all that stuff. I was like, okay. So I went over there and she's like, oh, found a coupon for you. Went back up to pay because it was going to be like $250 for something that used to cost me 50. Then they came up there and said, yeah, we found a GoodRx coupon for you, $22 for 3 months. I was like, how is
Isn't
it
that amazing?
how is it that I tell you I'm a cash payer now, you find a coupon for me and it's cheaper than the insurance that you were making me pay, and you never even mentioned that. I was like, what is the system going on?
Well, I mean, you're highlighting the problem with the system. There's so many middlemen in this system that we call them rent seekers. They're just trying to get their piece of the pie. And there's so many of them that it is one of the primary reasons that healthcare is so expensive in this country.
And then
We're seeing that all the time, by the way. That's not just labs. We're seeing that with major surgeries, imaging. I tell the story that I do labs generally every 6 months. And I get the basics. I don't need everything every 6 months, but the basics I can get for 70 or 80 bucks if I pay in cash. Whereas with my health insurance, it was something like $600 or $700. I'm just like, this is crazy that I can get these prices reduced by 90% if I just pay in cash.
Before I found you guys, I had corporate health insurance, and my concierge doctor, DPC doctor, he's got cash pay systems everywhere. And I had a shoulder issue, ended up getting a slap tear, and I needed to get an MRI done. And going through the normal health insurance world, that would have taken a week and a half to get the doctor visit, which I have to pay for. Then they'd send me to a specialty, which my copay for that is 90 bucks. Then I need an MRI. Their system goes x-ray first before they'll ever do an MRI. So that's 100 bucks. And then the MRI was 200 bucks with my copay. Just cash pay to get this done was 350 bucks. I got it in 2 days. That was my doctor recommendation. It's just showing the cash pay system versus what insurance is.
I had a pain in my chest. So I went to the cardiologist, and the cardiologist was like, 150 bucks. He's like, look, you really should get a stress echo. I don't think anything's going on, but you should get a stress echo. I was like, all right, that sounds expensive. He's like, no, it's like 200 bucks. I was like, great. So I went down the hall and I got it for 200 bucks. And I put this story on X, and somebody reached out to me and was like, you know what? I had the stress echo test. I got to do insurance, and it cost me $5,000. I'm just like, holy crap, $5,000 for a stress echo that I paid in cash for 200 bucks, or maybe it's 250, something like that. It's just craziness that this is allowed to happen.
I wanted to tell you, and also my audience, my experience so far. I signed up about 3 months ago, and it's 55 bucks per person. There's 3 of us, my wife and my 10-year-old daughter. So 165 a month. That goes to the company, which is great. Company needs to make money. Then there's the advocacy contribution fee for every month. And that could be for my family. Everything's different for people's ages and all that. Just let my audience know. But for my family, it seems like the Crowd Health will never ask me to contribute more than about $350 for my plan right now. So in essence, I'm paying max ever in a month, $500 to $600, when my corporate health insurance is now $1,350. So the amount of savings I just got there. With Crowd Health, they ask you per event that they want you to pay the first $500. It is not called a deductible, because you legally probably can't call it that, even though it feels like it. You pay the first $500 of any incident, then Crowd Health covers everything related to that cost, or it goes through the crowdfunding process with a 99% payout. If you go into the next year, they ask you to pay the next $500, and then everything else has come from that. And then there's every person gets a $300 annual wellness. I don't know if that's guaranteed, but it pretty much is. And that's for your doctor visit, your pediatric visits. So far, I've got DPC doctor. So Crowd Health is going to pay $100 a month. They're going to pay my 3 of those sessions for me and my wife. My daughter went to a pediatrician through Crowd Health chat team, found me a pediatrician at a cheaper rate. They accepted the cash pay offer. And then I submitted that to Crowd Health, and I got that paid out in 8 days. So far, This is my experience. Everything has been great. I've already gotten paid out by Crowd Health. So that's why I just wanted to put out there to my audience. Any other stories of what happens with bigger events like heart attacks, cancer, spine surgeries, that kind of stuff?
Sure. 2 comments on your experience so far. Clearly, I should have used Propecia too, because it didn't do very well on the hair side. But the other one too is, one of the things people are frustrated with these health shares is that they have this expense and then they have to wait 6 months, 9 months, 12 months. The worst I heard was 2 years before they actually got their money back. For the big bills, what we ask you to do is, assume you had to get shoulder surgery and it was $10,000. Oftentimes the health shares force you to come up with the $10,000 to pay the bill, and then you submit it back to them. Whereas for us, if you can tell us at least a week beforehand that you need to go and get this surgery done, then we'll fund it for you so that you actually have the money to go and pay it, so that you don't have to front that $10,000 and then wait forever to get it. The fast funding mechanism works really well. We're averaging about 2 weeks to be when you submit the bill to get paid. I'm glad yours was 8 days, which is awesome. But we're averaging about 2 weeks. We can pre-fund these big events if you have one. We've had some really big bills, dozens of cancer cases at this point. The hard one is, we had a guy who is, well, first off, our primary funding is going to, number 1 is babies. We just have a lot of people having babies. And so a lot of people funding babies. Number 2 is active injuries. So this is people out and about doing things that just get injured. They're playing basketball and they tear an ACL or whatever it ends up being. This one example is this guy was actually out fishing, funny enough. He was out in Montana and he was in bear wolf country. He had a 44 in his holster and he was fishing. He caught a fish. He leaned down. The gun fell out of his holster. It hit perfectly on a rock. The gun went off. The bullet went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and then out the back. And so this guy was 2 hours from the closest city, and he had to get a helicopter to pick him up off the side of this river. He was transported to the nearest hospital, went into a coma. Thank God he came out of this coma, but then he went into sepsis. I think he was in sepsis for 2 or 3 weeks. This was a massive bill, as you can probably imagine. But we've got a team of people who will actively negotiate that bill for you. As he was getting these bills, he uploaded them to our app. We consolidate them on our end. And then we have a team acting on his behalf that'll actually negotiate these bills down. I think ultimately that bill was almost $1 million. Our team negotiated it down to $200,000 or $250,000. Our community funded that in a month. We found out because his wife called us and we knew it was going to be a big bill. So before we even got the bills, we started crowdfunding to make sure he had the money. That's the great part of what we do. We can start funding as soon as we know about it. And then when the bills come due, you got the money, go and pay your bills. It works really well. We've funded 20,000 bills, everything from this injury, which was a big one, down to your pediatric visit. We've seen bills all over the place. I'll admit, when we were 2,000 members, I was a little nervous. But now that we're 10,000 members, I love the fact that we can help families, individuals with these really large bills in a really effective, cost-efficient way.
Part of the thing I've been seeing, experiencing crowd health for myself is everyone can go listen to the other podcasts with my Dr. Lenski's and you on Low Carb MD podcasts are revolving around the green check mark system and red mark system, which we can go into later. For anything you can plan, an actual 911 emergency, but anything you can plan, go through the app. People reach out to you in less than a day to help you find the best urgent care, the best solution for your problem. When it's done that way, you get a green check mark on your system that you went through Crowd Health first to help you. Like you said, with their team, you've got these lawyers, you guys know the lingo to find a fair cash-based offer. If we did it ourselves, we're just going to get burned, try to submit it to Crowd Health, and then the whole community is like, that's not fair. You didn't get the best rate. Now we all have to pay it. So it seems like this is the best method. Let the company do it on your behalf. And then the community benefits because everything's a lower cash offer.
Yeah, no, I think it's an important point because we don't have networks like your typical health insurance. So you can go to whoever you want. All we ask is before you do something really big, just let us know so we can try and help you. If we know there's an orthopedic surgeon in your area that can repair your torn ACL for $10,000 and you go to an orthopedic surgeon and pay $20,000, then we let the community know. We say, hey, listen, this person got this thing for $20,000. We know they could have done it for 10. You as a community now can decide whether or not you want to fund them. And most of the time, the community is like, look, you're not treating my money like it's your money. And so we just ask people to try to do a little bit of shopping before they go and do these things. You can shop yourself if you want, or you can have us do it. We will tell you that we've got a lot more experience. And so we're better at it. We're building this marketplace of cash pay prices where we probably have a really great doc where one of our members is already gone. We know that the doc will take cash and give you significant discounts as a result of that. So let us help you. And as you said, all you have to do is text us or email us. That's all in your app, a care advocate within Crowd Health. So when you signed up, you were assigned a care advocate. I don't know exactly who it is. Maybe it's Taryn or Kelly, but that person will respond to you every single time. This is not a big call center where, what I hated about health insurance is I call and I have to press 1 for this person and 2 for this person. And then you get sent to the wrong person. They got to transfer you to somebody else. And then you wait and then you tell your history and they're like, oh, well, I can't help you. I hate that stuff. I just want one person that I can call and contact and they will call me back. So that's one of the cool differences between us and health insurance and health shares is we've got a dedicated person for you internally who can help you navigate any of these big health events. One of the things that we hear with health insurance is like, if a big thing happens, what do you say? You're like, man, now I got to go fight my health insurance, right? And so it's almost like an enemy. We want to be your ally in helping you navigate through this complex system. And it's worked really well to date.
Yeah. And for God forbid an emergency happens, it tells you how the program works, what you should do in case of emergency. And by all means, you got to go to the hospital. Yeah. Knowing that now we're going to play this game, but then you call your advocate, let them know, don't pay anything. They have to treat you and take care of you. Yeah. And then you work with them. The problem with the health share was they were so late in paying they didn't start that way. They just got worse as the years went on. they were paying like 8 months out. So something like that happens, you're not going to pay because you're waiting for them to kick in. The hospital would have already sent you to collections and ruined your credit before this health share kicked in. So knowing that right now you guys average is 2 weeks, that is light and day different.
For ER visits, we want you to go to the ER if it's a life. You can't negotiate with the ER on the way. So what we do is on the back end, we'll negotiate. Because like you said, there's a federal law that says you have to provide care to people who go into the ER. So they can't decline care for you, but we can be pretty active on the back end and negotiate that.
Well, that's great. Well, Andy, I wanted to ask some questions of things that I found with Crowd Health that I wanted to inquire about selfishly more for my issues. That's why I really want my audience to go check out my other doctor's podcast, Low Carb MD, because totally different questions on there. And it was awesome listening to two doctors grilling you. You just had answers for everything. It was so awesome. That's what sold my doc. So first and foremost, I signed up and didn't read the FAQs that are actually on your website, knowing that if you live in the great state of California and some other ones that have this minimum insurance, we're getting penalized for being poor and can't afford health insurance. And now I know that I don't have minimum insurance. I've reached out to my accountant, but he's so busy, right? Because we're almost at April 15th.
Yeah,
so
in the middle of it.
I'm waiting to hear back. But from what I can tell, it seems like I'm saving so much money. But anything else you can advise on that?
There used to be a federal law that you have to have health insurance or you're going to pay a fee. The law is still there, but the fee is zero. So you don't have to worry about it on a federal level. There are 5 states in the District of Columbia that do require you to have health insurance or you pay a fine. The 5 are California, Vermont, Massachusetts, New Jersey, and Rhode Island, I believe. If you live in one of those states, we've got a calculator on our website that you can check out. If you want to know what that is and you can't find it, just reach out to your care advocate, or you can just go on Google and find it. What we found is that most people are saving way more money with Crowd Health than what the fee is. We still have pretty substantial groups of people in all of those states. So yeah, that's just unfortunately one of those silly laws that we have to deal with.
There is an actual calculator on your website that I can check for what it possibly could be for me in California.
There's a link to the California website that allows you to navigate that. Like I said, if you can't find it, it is buried. So reach out to your care advocate and they can direct you to it.
Okay. Because I researched myself, it looks like the max it would ever be would be like $4,500 for a family of 3. And then if I try to jump in one of the cheapest health shares out there just to have it, because in California, they consider that minimum health insurance, but literally would be almost what I'm saving with doing Crowd Health. So it's almost better just to pay the fee in my personal situation.
Sure.
Okay. Next question is any crowdfunding that comes through, and I did get some. So I had my daughter go to a pediatrician, $311. I paid the 11. I got the 300 from the crowd in 8 days. Is that money considered taxable income? Will it be known as was to pay medical expenses, or do you know?
Yeah, so gifts aren't taxed. These are peer-to-peer transactions. So these are other members gifting you money, and those are not currently under the IRS considered taxable income.
Okay. I'll check with my accountant on that per state. Cool. I noticed when I was looking at the FAQs, you can use this for dental and vision, but it came back to your $300 annual wellness for the year that everyone gets. You choose that to use that for your DPC, a pediatrician. You can use it for vision, dental. Okay. But if I have any issues, dramatic issues to my eyes or my teeth that needs like really extensive surgery or treatment, can those be crowdfund opportunities, or does crowdfund opportunities have to be anything wrong with you blood wise or organ wise, not teeth and vision? Because that sounds like separate insurance.
So if you have a root canal or cavities, that is not eligible for funding. However, if you have a significant event, so we actually had a woman who documented her story of Crowd Health on Instagram. She fell and broke her jaw in, I think, 2 or 3 places, which means she needed significant jaw work and teeth work, because I think she banged out dental work that she had to do was something like $10,000 or $15,000. That is eligible. So if you have a dramatic event that includes your teeth or eyes, that is eligible for funding. Otherwise, if it's just maintenance stuff like root canals and cavities, those are not eligible.
And on your website, there's a whole place to show all the different stuff that isn't eligible as well. And I'll put a link to that. I was looking on your site for, like I said before, if you go through Crowd Health app on anything, as long, obviously it's not an emergency. And recently my wife just got a little spider bite and it was really creeping up her leg. We're getting scared. We're like, God, do we need to just go to urgent care? On your site, it says, if you can, you really push using the telehealth urgent care to really see, like, give you guidance. Do you need to go in, or can we just prescribe you something because we know it's a spider bite and you can show them pictures and all that? That's a great thing about telehealth. But then I realized, oh, that's a $130 cost. Okay, that's not bad. It's a pretty cheap urgent care visit. But if they do tell you you got to go to the physical location, now you've paid the 130 plus you got to go pay the new urgent care, right? Or am I wrong on that situation?
Yeah, actually, those virtual urgent cares are fully fundable by the community. So we have a virtual urgent care on our app. If you go through the app and you press on virtual urgent care, it is $129. You pay it up front. Any of that virtual stuff you get through our app is fully fundable. So what we tell people to do is like, look, pay the 129. That's fully fundable. And most times that will keep you from having to go to full urgent care or even the ER. I have personally used it, I think, 5 times over the last 18 months because I thought something was urgent care worthy. Every single time that urgent care doc was able to deal with that virtually in the comfort of our own home, as opposed to having to go to an urgent care or a hospital. I think it saved me probably $10,000 over the last couple of years by using that, but that is fully fundable by the community. We want people to use that liberally.
But you're supposed to pay the first 500 per occurrence. It's fully fundable, meaning it's going towards your annual 300 allowance, or is this separate?
No, this is separate from that.
Oh,
So
wow.
there's a couple of things that are separate from that 500 and a couple of them that you've already mentioned, which is this wellness visit. There's no 500 minimum on that. You get one wellness visit a year up to $300. The other thing that it doesn't apply to that 500 is these virtual urgent care or virtual primary care visits that you can find on our website. We also have virtual counseling. So if people want to go and do counseling, that's actually fully fundable by the community too. So there's a couple of kind of caveats to that
Wow.
$500, but those are fully fundable. So definitely use them if you're a Crowd Health member.
Are those unlimited or only like one per year?
You can submit as many as you'd like in the community.
That's even more powerful. So that's the great thing about Crowd Health. You use these services whenever you want. If you know something's coming up, you use these services because they're fully fundable. That is awesome. Well, Andy, I noticed other things. One of the comments that was made on the other podcast I keep mentioning about how Crowd Health was really pushing better biomarkers and blood reports and actually getting discounts. I forgot what the name was or some kind of scan, the DECA scan that you guys are offering right now. If you pass this, you can get like 10% or something off your thing. How many different opportunities do we have like that? Because I feel like I'm going to crush all of them and I want to sign up for these as soon as I can.
We have a quarterly special. So this is another kind of caveat to that or exclusion to that $500. In the first quarter, we did DEXA scans, which basically takes a full scan of your body, gives you muscle mass, gives you visceral fat. What we're really focused on is that visceral fat level. People look at your weight as the ultimate guide, but in reality, what it is the visceral fat. That's the fat that hangs out in between your organs. That's really important. Q2, we're doing gut health. So you take a stool sample, send it off, and they'll tell you what's going on with your gut health. We're doing VO2 max and coronary artery calcium scores, this for Q3 and Q4. The second thing is if you are metabolically healthy, the primary indicators of that are visceral fat levels, which I just mentioned, or fasting insulin levels. If you have visceral fat in the bottom 25% of the population, or you have a fasting insulin below 5 or 5.5, you get a 10% discount on Crowd Health. Those tests are fully fundable. And if you do get that, you actually get a 10% discount off of your Crowd Health membership. In Q4, we're going to open that up to, if you get both of those done, visceral fat and fasting insulin, you get 20% discount. You can get a pretty significant discount off of Crowd Health if you are on the path of being healthy. We think that healthy people should be incentivized to stay healthy. People should be incentivized to get healthy. These are just a couple of things we're trying to do to not only drive down prices, which is really important, but if you really want to change our healthcare system, we need people to understand how their body works, how their body operates, and get healthier, especially metabolically.
Yeah, that's great. So every quarter, one of these, they're not considered for that 500. They're their own kind of separate things, which are all fully fundable. Plus, if you pass, you get the discounts. Now, if you missed one of those quarters, you had to have gotten it during that time you guys are offering it, or all these are still all available whenever you get it?
The fasting insulin and the DEXA scan are available anytime for you to get data on your metabolic health for those discounts. The other quarterly specials are a separate thing. You have to do them during the quarter to be eligible. We're doing gut health right now. You have to do that before June 30th to make that eligible for funding.
Now I know to start paying attention to those and the newsletters.
We send out one newsletter. We try not to bombard you with emails. We send out one newsletter a month, and those, it's just like the top 5 things going on with Crowd Health. And so anybody who's a member of Crowd Health, highly recommend that you read those. It takes you 2 minutes to read through it, and it gives you a really good cheats and tricks and hacks for healthcare, but also what's going on with Crowd Health.
I read the last one I got, my first one. It was cool seeing the pie chart of how the money's being spent in real simple newsletter, not too wordy, just like you said. And right on the bottom, just a spotlight of a member who's in need. You guys were obviously taking care of all these bills, but they had other problems because they weren't working. And then the family's Venmo, if you want to help out, I was like, oh, I shot $50 over to them and got
That's
a nice
awesome.
little
Thank you.
message from the member. So I was like, this is what I've always been wanting in my whole life for
Yeah.
health insurance.
Yeah, no, we had a member who was going through some really hard health stuff and wasn't able to work as a result. The bills were piling up. So we made a one-time ask from our community to help them out in a time of need, because that's ultimately what we want to do. We want to see people thriving throughout their life. And she was able to raise enough money now that they can get some of those bills paid. Dad was in the ICU with meningitis and he couldn't work. She had to take care of the kids. One of her kids had just gotten diagnosed with autism. That was a challenge. We're really trying to help our members get through some of this stuff. With probably every quarter is to spotlight a family that's going through some hard stuff. And if we as a community can help out, we have no idea who gave to her. It's just a one-off thing of somebody in the community needing some help. And the community really stepped up to help her. So that was super sweet.
I just keep more and more things. I just keep liking about how this is all set up, and wish I had this my whole life. I've been self-employed since 2011, dealing with all these problems.
Most of our members are self-employed, gig workers, they're freelancers, they're entrepreneurs, they're people who aren't, for the most part, getting insurance through their company. More and more, we're actually getting people who have healthcare through their company coming over to us and declining their corporate health insurance. Health insurance is so busted and it's becoming really expensive. About 20 to 25% of our members actually decline their corporate health insurance and have come over to us because it's so much better than what you expect out of health insurance.
And that's why I wanted to say that this sounds perfect. And like you said, most of everyone is probably self-employed or unemployed, but why would anyone who works for like a decent job that has all these benefits come over to you guys? And I literally just talked to a friend last night who works Port as a director. Great job, great benefits. His wife was saying they still have random fees, $500 for a simple doctor visit. And it's like, I thought you guys had like the greatest health insurance ever. So even he's having problems and might be considering just tacking this on and keeping both.
We'd love that. I always say that no health insurance is great health insurance. Works until you have to use it. And that's the challenge. People don't understand how screwed up health insurance is until they actually have to use it and then have to deal with it. And it's very burdensome. In fact, 200,000 families last year went bankrupt due to a medical event, even though they had health insurance. Yeah. So health insurance is not helping oftentimes. And 20% of claims sent to health insurance plans are denied. You have a 1 in 5 chance of getting denied. So if you think health insurance is a sure thing, unfortunately, that's just not the case.
This is great. I love seeing these new ideas coming out and trying to fix this problem, because I just see it getting worse. Before I switched over to you guys, my health insurance advocate or whoever's that was in my network, he helps people who are unemployed get on these programs. He's just saying, like, just expect a 5 to 10% bump every year, if not more. It's just getting worse and worse because they got to spread the cost somehow of how mismanaged this whole system is. And I don't want to be a part of it. It's not fair. I'm not getting these group discounts that all these companies are. Now we have something that seems a lot better with the health share. So I appreciate what you're doing.
Oh, we appreciate you becoming a member. Funny enough, our rates in 2021 were actually higher than they are here in 2025. Our rates are going down as opposed to going up, like health insurance plans. We've gotten better at what we do over the last 4 years. And as a result, the prices have come down on these bills. So it's been fun.
Yeah. And like I did with the health share company, as your business is getting beat up by claims and you're managing it properly because your company actually cares, it's for profit, premiums may go up or down a little bit. I'm fine with it. It's literally more than half the cost of what I was already doing. So say Crowd Health is getting mismanaged, and over the years, we'll see the premiums slowly going up. Same thing that happened to me with HealthShare. I hope that doesn't happen. That's how a good company runs, by letting their community know what's going on. And if we get hit with something big, we got to spread the hit and recover. Right now, the contributions, at least for my family, nothing can go higher than like around the 350 mark. That's no problem. And the first 2 months I've been in so far, it's been 130.
Yeah. I mean, I think it's important to note of, like, we give you a maximum for an individual. You'll pay $55 to Crowd Health and then up to $140 for helping out somebody else in the community. But we only ask for what the community needs that month. This month, we're actually only asking for 80 of that 140. So about a little over half, I guess 40% less than the max. If we get some big bills, we might have to go up a little from that 80, but we will never ask you for more than 140. That excess $60 this month, we say, hey, you go and do whatever you want with it. Go buy a ribeye or whatever. Go take your wife or husband or whatever out to dinner. In the health insurance space, if they have a really good month, they profit. If our community has a really good month, you actually profit. You keep the money. That allows us to flex up and down based on the bills. It's easy to budget for. And if we are coming lower than what you expect, then have a party.
That's exactly what I'm doing. I'm budgeting for 600, which I can't even believe that I've got my family down. And then anything extra that's coming in, just investing it immediately. That's how I'm running things.
Love it.
Well, very cool. Andy, before we finish up here, is there any final thoughts you want to throw out to my audience? They can get a lot more info from the website, a lot more info from that other podcast with my doc. We'll go into what can my members take the next steps? How do they do this?
It's super easy. Join crowdhealth.com. You can start whenever you want. It's month to month. You can end whenever you want. It takes somewhere between 5 and 10 minutes to sign up. The only exclusions are if you're over 260 pounds or you're a smoker. We'd love for you to join us. Join crowdhealth.com.
If you had a previous issue with cancer or surgeries, you need to have a certain amount of time being cleared from those before being able to join Crowd Health. And that helps to protect the community too. I really appreciate that part, and the part that someone can still strive and work on their health to clear those time marks so that they can still join Crowd Health. A way for everyone to get in. That's what I love. Thank you, Andy, once again for coming on my show. Perhaps in a year, I'll get you back on and tell you all my experiences once again. I'm really sold on this idea for health insurance, and I want to put it everywhere in my community.
Yeah. Ditch health insurance and come over to Crowd Health. We'd love to have your listeners join us. Thanks for having me.